I'm fortunate and grateful, and I've told Somi this time and again that had I not worked for HerMD and learned about all of this, I would not know. And now I know so much, I'm self-diagnosing myself. I'm like, I'm perimenopausal. I know I'm perimenopausal. I'm hot, I'm cold, I'm dry. Dry a lot of places, right, that we talk about, but Somi.
Very dry.
Right? Yeah, like it's like a new evil chapter or something. I don't know. But you won't be if you come to HerMD. It's like this bad chapter or something, but I know that there's so many treatment options. But Somi, talk a little bit about perimenopause and menopause, because you talked about, I started perimenopause, and like how long does that last, and some of the classic symptoms that we should be looking out for.
Yeah, so the average age of menopause is 51 in the United States. And so menopause can be defined a few different ways. It's 12 consecutive months with absolutely no bleeding, or a doctor can do a blood test checking the FSH, which is the menopause hormone. And if it's elevated, because it starts to go up, trying to wake up the ovaries going, where is the estrogen? And so there's another way, because there's women who've had a partial hysterectomy or an ablation, so there's blood testing that you can do as well. But perimenopause can have all the same symptoms from head to toe. So I tell women it's way more than a hot flash. I mean, even Oprah thought she had cardiovascular disease, but it was palpitations from perimenopause. And so you can have cognitive decline, like when you put your phone in the refrigerator, or where you forget where your keys are, and it's much more common. Word finding, calling your children by the wrong names. I mean, really it affects us from head to toe. Weight gain, being dry everywhere, and that can, aside from vaginal dryness, sexual pain, it can also be joint pain. Weight gain. And where does it get you? It gets you in your middle. And so my patients now call it their menopot. They're like, Dr. Javaid, what can you do about this menopot? I didn't mind when I gained it in my breast and my hips, but this stinks. And so there was actually a study where they looked, and I'm not calling you mice, ladies, okay? But they took mice and they gave half FSH, so made them menopausal, and the other half, they didn't. They all exercised the same and ate the same. Every single FSH or menopausal mouse became obese. And so it changes the way we deposit fat in our body, and it also changes our metabolic rate. So many women come in with self-loathing and hate and going, oh my God, I just need to exercise more, I need to eat less. And it's like, no, your body is programming, these changes. It's not your fault. So that's the first thing we have to remove. Sexual dysfunction. And so what do I mean by that? No libido, problems with orgasm, problems with arousal. So libido or desire is the intent. Like, ooh, I want to have sex, or I want to be intimate. Arousal is your body's physical response. So not being dry, your heart rate going up, getting into it. Some women will say, oh, I want to, but even when I'm with my partner, I feel dead. I feel nothing. Or they'll describe themselves as, it used to be rainbows and now I feel beige. And, I remember all the stories, sexual pain. And when something hurts, guess what happens to your desire? Who wants to go do something that hurts? We eat ice cream, we eat sugar because it gives us this euphoria in our brain. Nobody wants to have sex if it hurts. And so those are just some of the symptoms. Anxiety, depression, insomnia.
Rage.
We were talking about that earlier, weren't we? And then, yes, and flying off the handle. You know, people are like, oh my God, I yell at people and I don't want to anymore. Yeah. Or
I don't mind it so much.
I know, right? Like, I want to now.
Going to sleep and waking up in the middle of the night and then not being able to go back to sleep. I mean, there's many, many gifts. But when I get really, really angry is when people offer alcohol as a treatment option. So you guys have all gotten menopause treatment today if you drank, because apparently that's the latest, greatest technology. Or they're told to grin and bear it, or they're told that there's nothing they can do and there's no options. That's when I literally want to pull out my hair and look like the Mr. Clean Man, because...
Yeah. I mean, I was going to say that the fact that this is your take on it is what's so revolutionary to me. It is not a surprise, really, that this is happening right now. I think our generation is really going to change the entire conversation about menopause, and it is happening, in some ways, I think, because Gen X will not take no for an answer. No. And we're in the middle of it, and we're like, wait, there's no info? So, Dr. Javaid is really giving us the lowdown. And the fact is, it is absolutely unacceptable for your doctor to dismiss any symptom. And just the one thing I wanted to say, just in support of you, is that you, everyone out here, you really need to be your own health advocate. And vote with your feet, as my friend Omi would say. That means walk if you do not get the standard of care that you deserve and that you feel. And we've been taught as women to feel unsafe in our bodies and not trust ourselves. Start listening to your own instincts and do not take no for an answer when it comes to your doctor. Don't stop until you find a Dr. Somi who can truly help you and hear you and become your co-conspirator in your own health.